Hello and welcome to Module 10, Clinical Assessment, Mental Health, and Mental Disorders. What is psychopathology? We will be defining mental health and psychopathology by looking at a multidimensional lifespan approach to psychopathology that focuses on biological forces like health problems increase with age and can provide clues about psychological difficulties, for example, reduced appetite as a symptom of depression. We will also look at psychological forces, normative changes in attention, memory, and intellectual performance that can mimic mental disorders. And likewise, changes can make it difficult to tell whether an older adult has a given pathology. We will also look at sociocultural forces. Social norms and cultural factors play a role in helping to define psychopathology. Such social norms and customs vary across cultures. So we must ask if the behaviors are appropriate for a particular person or culture. This module includes life cycle forces, or how a person behaves is influenced by one's past experience and the roles that ethnicity, gender, and aging play regarding mental health. And of course, social disparities that can result in different prevalence of mental disorders. From there, we'll move into developmental issues and assessment and therapy, such as areas of multidimensional assessment being a formal process of measuring, understanding, and predicting behavior, and multidimensional assessments that are often done by a team of professionals who assesses physical health, cognitive functioning, psychological functioning, daily living skills, and social environment resources, including mental status exam, that are quick screening measures of mental competence used to screen for cognitive impairment and follow up with factors influencing assessment like negative and positive biases, along with non-optimal environmental conditions can influence accuracy in assessment. We'll look at assessment methods and development issues in therapy, such as medical treatments, like medications, which are based on underlying physiological causes or of disorder, and the ways medications work with age and how over-the-counter medications can interfere with prescription medications. From there, we'll move to psychotherapy, which involves talking with a clinician or working in groups, and positive approaches, and their effectiveness on age-related needs. Both require one to be sensitive to development issues of older adults. Finally, we'll explore the big three: depression, delirium, and dementia. Depression and how less than 5% of older adults living in the community show signs of depression. Delirium, characterized by disturbances of consciousness and changes in cognition that develop over a short period of time and can be caused by a number of medical conditions, medication side effects, substance intoxication or withdrawal, or even exposure to toxins, sleep deprivation, fever, or some combination of the above. Rounding it out with dementia that affects about 48 million people globally, and the families of dementia, characterized by cognitive behavioral deficits involving some form of permanent brain damage. And now Alzheimer's disease, the most common form of progressive, degenerative, and fatal dementia, accounting for as many as 70% of the dementia cases. We'll look at other mental disorders and concerns as anxiety disorders, including anxiety states with no specific trigger, phobic disorders characterized by irrational feels of objects and circumstances, and obsessive compulsive disorders, which are actions performed repeatedly. Psychotic disorders involve personality disintegration and loss of touch with reality, also known as psychosis. And wrap up with a look at hallucinations that are distortions in perceptions and delusions, a belief system that are not based on reality. Lastly, substance abuse. And with the exception of alcohol, the types of substance abuse will vary with age. Welcome to Module 10.